Good morning. My name is Dr. Anam Khan, and I'm an assistant professor of medicine at MD Anderson Cancer Center. Myself, along with Doctors Maitra, Wang, and Chari, are bringing this abstract called Pancreatic Cancer Associated Diabetes Improves Following Neoadjuvant Therapy. The background for this study is that we know that pancreatic adenocarcinoma causes new onset diabetes, and it makes pre-existing diabetes difficult to control despite attempts at weight loss. Pancreatic adenocarcinoma associated diabetes resolves or improves following surgical resection of the cancer. We as a group aim to study the effect of neoadjuvant therapy on glycemic parameters in patients with pancreatic adenocarcinoma with diabetes. We identified patients in our tertiary referral cancer center who were treated for pancreatic adenocarcinoma with neoadjuvant therapy prior to surgical resection from a time period spanning from January of the year 2000 to December 31st of the year 2012. These patients had to have had a diagnosis of diabetes at the time of pancreatic adenocarcinoma diagnosis, and they should have had serial hemoglobin A1C measurements during the course of therapy. In such patients, we abstracted data along with hemoglobin A1C. We abstracted data on serial weights and their anti-diabetes medications. We developed an ADM, an anti-diabetes medication score, based on the type of anti-diabetes medication that they were using, and we gave them cumulative points based on the kind of anti-diabetes medication that they were using. And the scores are mentioned in this slide. We compared the ADM score before and after receipt of neoadjuvant therapy. Our results are as follows. We included 43 patients with a mean age of 67.4 years, with 65% of patients being males. We found in our study cohort that 63% of patients had new onset diabetes and the rest had pre-existing diabetes. The interval between the start of neoadjuvant therapy and surgery was on average 4.8 months. The A1C normalized prior to surgery in 54% of patients following neoadjuvant therapy. The cohort's mean A1C fell significantly from the start of neoadjuvant therapy to their preoperative date. And compared to the massive weight loss that patients experienced prior to initiating neoadjuvant therapy, our cohort's weight remained stable during the course of neoadjuvant therapy. Our cohort's ADM score rose significantly by 1.5 points following receipt of neoadjuvant therapy. 8 out of 9 patients who were on insulin before neoadjuvant therapy initiation continued to require it. An additional 11 patients were treated with insulin during neoadjuvant therapy with significantly better A1C values before and after neoadjuvant therapy. And 5 patients needed no anti-diabetes medications. The conclusion from this study is that neoadjuvant therapy of pancreatic ductal adenocarcinoma makes diabetes easier to control. In our cohort, the A1C normalized in more than 50% of patients prior to surgery. Since complete tumor response to neoadjuvant therapy is rare, partial tumor or stromal response to neoadjuvant therapy seems sufficient to improve glycemic control in pancreatic adenocarcinoma associated diabetes. Thank you.